us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so in this video, we're going to look at some new technologies and treatments in the healthcare system. I could have given you pages and pages of examples here, but I've just tried to nail down a few of them, otherwise the video will go way too long. So let's look at reasons why we would use technology in the healthcare system. And before I start, I probably should mention that pretty much all technologies and treatments that are new and evolving are excellent. They're better than what it used to be, but it does come with the negative of access and cost. So technology is to measure, monitor and diagnose health issues in patients. So imaging technology has obviously come a long way to diagnose and monitor internal structures, bones, organs, etc. MRIs is probably the biggest one and the most expensive one currently. Pathology testing, so testing of bodily fluids for diseases such as a rat test, or you can get blood tests now. Particularly, there are certain markers in bloods that do show up for cancers as well, which is good. Genetic testing, so identifying DNA mutations for early detection of certain diseases and mainly cancers. So for example, if you are a female and you have a long history line of women in your family getting breast cancer, then there's certain DNA markers that they can look for in your blood to see whether you are more or less likely to get breast cancer. And backing off that, we also have epigenetic testing, which basically just looks at general markers for certain risks of disease. And sometimes epigenetic testing can actually diagnose disease like cancer before the patient even has signs and symptoms that they have got cancers growing in their body. So it's really, really powerful, and it's definitely going to be more important as we move on into the future. And if you start thinking about integrating AI into this data analysis as well. So we've also got technologies for treatment. Okay, so treatment is not as extensive as to measure, monitor and diagnose. Pharmaceuticals have come a long way, so look at chemotherapy. Regardless of whether you are a new patient getting chemotherapy or an old patient, chemotherapy is just horrible on the body, but it is better than the alternative of, obviously going through cancer without getting treatment. So it is a horrible experience, but very, very good advancement in medical. And surgery. So I covered this in the previous video. So we had a few different methods, but just reminding you here about the Da Vinci Xi system, which is able to make those precision cuts that normal surgeons may struggle with. Well, it wouldn't be a video on new technologies and treatments in the healthcare system if we didn't talk about AI. So artificial intelligence is currently being used, and more so every day, to analyze medical imaging and specific reports to diagnose conditions. It does, to an element and degree, but there's a double-edged sword here, it does remove human error. So a human may look at a data set, a doctor may look at a data set and go, oh no, this patient's fine, whereas AI may actually pick something up that was missed. So for example, there is an AI suite called Harrison, and it incorporates a whole bunch of other things, and I don't know where they got these names from, but so Annalise AI is the specific one that analyzes chest x-rays, looking for fluid buildup, tumors, etc. And there is the Franklin AI, which analyzes pathology, so fluids and bloods, etc., and they're all part of the Harrison suite. Okay. A team of pathologists would need to generally sit down and analyze all the data themselves, which may take them, by the time you're at that sort of level, it's probably only going to be taking you minutes, okay? But over the course of a day or a week, you may only be able to sample size, 50 to 100 patients based on the data, whereas AI can pretty much do all of them, not instantly, but pretty much instantly. So it is extremely time-saving, which is the main benefit here. So AI's main benefit is able to process large data sets to build trends, over time and diagnose patients faster, all right? So if there is a patient, for example, who is presenting to a clinic with a certain issue, instead of the doctor just seeing them there and then in that one instance, AI, if we had better e-health records, which we are working towards, would be able to look at that patient's data there and then, but also over the last 10, 15, 20 years and go, hang on a sec, actually, this has been an ongoing thing. I think X, Y, Z. So it's obviously not all positives. So AI is not 100% accurate, okay? It does make errors just like humans do, which is always why a human probably needs to be at the end of the chain to double check the findings, okay? So if AI says this is this or this isn't that, a human probably still needs to be there to go, yep, that's all fine, all right? Because AI data and the analysis and conclusions that it comes to is based off algorithms. Algorithms are basically built on data sets from many, many previous years, and it may overlook the outliers. So just because you are not like at a 98% confidence interval for something doesn't mean you actually don't have the condition, all right? Just because you are out here and everyone else is here, this person may get overlooked by AI, but a doctor will pick them up, hopefully. The other issue with AI is obviously data privacy, and the same goes with the e-health records, right? People are worried that if all of this data is being put through a computer system and it's on the web somewhere, like obviously behind many, many encryption firewalls, etc. But if someone gets that data, then people are like, oh, I don't want people knowing that I have, heart conditions. But, to each their own. Also in the technologies area, we've also got apps, and apps are always improving. So things that are on your mobile phone, just about everybody has a mobile phone, so why not put them to use for your health? Common ones include HotDoc. So HotDoc, you can just open up the app, book in a doctor's appointment, so it takes away that barrier of actually having to call or find a doctor's surgery. They can even link you up with a telehealth service as well, so you don't even need to leave the comfort of your home or wherever you are, that you're using the app to book a doctor's appointment. You can also request scripts through that, so you don't actually have to have an appointment to get a script. You can just go, hey, I need a script. The MyGov Health Record app is actually being updated all the time, and it's getting better. So you can go onto the MyGov Health app. You will all actually have an entry on here if you're if you're part of Medicare, and it will have like all of your blood tests and times you saw the doctor, etc., all linked up there. So if you ever get a blood test or any sort of imaging or anything done, it all gets uploaded there, and you can have a look. The FeedSafe app, so this is just a simple one that helps breastfeeding mothers if they happen to be partaking in alcohol. It helps them know that when their last drink was and when it would be safe to breastfeed or express, etc. Assistive technology is probably the area that is going to get the biggest rise, particularly with our growing and aging population. So this is probably the important one, that if you forget everything from this video but not this part, do that, okay? So assistive technology is technology that is going to enhance independence and inclusion. And we know that with our growing and aging population and there being more elderly people in society, but also there's no beds because of the bed block phenomenon, we need to keep these guys at home for as long as possible. And assistive technology is really going to help with that, okay? So it enables them to, get about their day-to-day lives and maybe even interact socially out in the community and leave their house, etc., without the need of another person there to help them. So NDIS does fund assistive technology, but the current statistics say that only 10% of users are getting funding through NDIS for this, because once again, like I said at the start of the video, this stuff's expensive, okay? They don't just like sell them at Big W. You can go and pick up your own Callaghan Smart Cushion, all right? So, a couple of examples. Callaghan Smart Cushion, I just mentioned it. To prevent pressure sores, so there are a lot of people that are bedbound, whether you've got ongoing heart, liver, lung, any reason why you are stuck in a bed, okay? So I remember when my mum was in hospital, one of the nurses had to come in a few times a day and actually had to roll my mum while she was in a coma to make sure she didn't develop these things called pressure sores, okay? This is basically where blood will pool in certain areas of the body, which then can cause bruising, and then the bruising can extend, and then you end up having like internal hemorrhaging and stuff like that. So with these cushions, they basically, not all the time they're moving, but they shift and they move the body so that, if you can think of like a balloon full of water, that water is constantly being rearranged so it doesn't pool anywhere, all right? So that, for example, would eliminate the need for a nurse in particular to do that job in hospital. So there's, that's good. I mean, it's not good for the nurse, but, she's busy. She's got lots of other stuff to do, trust me. Another one which I read about was the Glass House Pro. So it is basically, it connects into a digital device, so it can be hooked up to laptops, but also mobile phones, TVs, etc. And it enables the user to control that device via head movement, so it tracks where their eyes are looking, and also using a sensor in their mouth to sort of bite down. So you can imagine like if I was trying to work a laptop, but I didn't have mobility with my arms or hands, for example, I could use this and I could move my mouse cursor around and sort of bite to click and stuff like that. Really, really good, right? But once again, expensive, right? They're not just flying off the shelves at Kmart. Others worth a mention, all right? So like I said, I could have gone through heaps and heaps and heaps of different technologies. There's so many. You guys should look some up. Some of them are really cool, and where we're going with technology is really cool. But others worth to mention, wearables, all right? Most people have a smartwatch or something smart these days, but those do track your health and they do encourage healthy habits, all right? Wireless monitoring, all right, so these can be used in like rural and remote communities to monitor the health status of people there. So for example, if someone has had like cardiac conditions in the past and they're nervous about that and they're nervous about leaving hospital, well, they can send them home with like a cardiac monitor that they wear, and if an issue starts to arise or if there is something that's not quite right, it does flag in the medical system, and then someone hopefully calls them and be like, hey, you should probably make your way to a hospital now. 3D bioprinting of prosthetics. This is really cool. All right, so in the past, obviously, we just have these generic, prosthetic hands, arms, legs, etc. Over time, they've gotten better. We're at the point now we're able to print bespoke equipment that is like identical to the one that needs to be replaced, all right? And it is perfectly fitted for the person needing the prosthesis. Obviously, way more expensive than just your generic ones, but hey, it's really interesting. Gene editing. So there are lots of conditions that are basically genetically not inherited, but you have a high likelihood of getting these genetic conditions. So there are certain methods these days, and this is one of the developing methods that we're seeing going forward, whereas individuals can actually edit their genome so that they do not get those conditions. And that's a fascinating science that is certainly going to be expanding. And finally, smart implants. You know what? I should have led off this video with smart implants, because I reckon if I asked everyone, oh, can you think of a piece of technology that's been helping people for years, it would be ear implants, all right? People have been using cochlear implants for many, many years now, and they're only getting better and better. Actually, I heard a funny story the other day about people. You've got to tune them as to like how far away you want to hear things. Apparently, they can pick up sound that's like much further than humans should naturally be able to hear, and people are able to listen in on conversation. Anyway, it was really interesting. Anyway, there's some others worth a mention. Assistive technology is where the main bulk, I believe, in Australia with our growing and aging population we're going. And overall, that is the end of your video on new technology and treatments in the healthcare system. Thanks.